Hello and welcome to the Terp Family Fundamentals webinar series. My name is Kate Belquist and I work in the Office of Parent and Family Affairs. This webinar series is intended to help you become informed consultants on campus resources. We know that your students are going to you for help in their decision making, and we also know that your students are going to you when they're in the middle of tackling their problems. And certainly being sick away from home is a problem that they will likely have to tackle at some point in their college career. So we like to say that during the normal course of events, there really is no problem that can arise at the University of Maryland that can't be solved using the many resources available to them here. So our goal is to provide you important information and tips to be most effective in helping your student. We have about 40 to 45 minutes together today, and you can feel free to submit questions throughout. We'll make sure we get to them. The webinar is also being recorded and will be made available on the Terp Family YouTube page. So just in case you need to leave early, don't worry. We'll make a recording available to you. Today we're joined by Dr. David McBride, who's the director of the University Health Center, to talk about how to help your Terp when they get sick on campus. We're very excited to have him with us here today. Before we jump in, we're just curious to know who is in the room. So you're going to get a poll sent out to you asking which class your student is. So if you could take the next few 30 seconds or so to share what class your student is in. Right now it looks like we're overwhelmingly first year. We got some sophomores and juniors, a couple seniors. Just give it a few more seconds. Great. Okay. So it looks like 90% of the people in the room today are our first year parents and families. So thank you so much. I appreciate that. So welcome, Dr. McBride.
Thanks, Kate. I appreciate it. Can you hear me okay? Great.
You sound great.
Okay, perfect. Well, thank you all for having me. It's a little weird to stare at a computer screen and be talking to people in the ether, but I really appreciate the opportunity. My name is David McBride. I'm the director of the University Health Center at the University of Maryland. I've been at Maryland for about 4 years. Prior to that, I was in Boston at Boston University directing their health center. I'm a family physician by training and have done college health for about 14 of my 20 years in practice post-residency. So it's a pretty fun place to be in terms of a practice setting. So I wanted to just spend some time talking about the things that I have listed on this page. So some talk about empowering your student to make smart health decisions, some simple things that can help your student to stay healthy, a bit of advice about health insurance, some health dangers that really should make us nervous, a little bit about common episodic illnesses, how often is normal for illnesses, and then also, and probably most importantly, the issues of how best to communicate with your student through an illness when you're potentially far away and they're here on campus. I also did want to spend a little bit of time on antibiotic use because it is an area within college health where we get a lot of feedback from students in particular who think antibiotics are often the solution to their problem when in fact the data would suggest otherwise. So we'll spend a little time on that as well. So I tried to interject some cartoons here just to keep things light. So what I wanted to talk about first is just sort of what should we be worrying about as it relates to illness in our college students, because what we should worry about is not always what we do worry about. You know, I think drug companies would have us believe that scores of students are dying every year of meningitis B, and the reality is that is really pretty far from the truth. Not that immunizations are ever a bad thing, but it does create a little bit of a misguided impression about what things actually do cause harm to students. And so I wanted to take a minute and just talk about the perception of risk. So in the fall of 2016, there were about 20.5 million college students who attended American colleges and universities around the country. In your own mind, of the following three, just think which you think is most likely to cause harm to a college student. Is it A, meningitis? Is it B, suicide? Or is it C, alcohol? So I hope you've all made your internal decisions. So meningitis, causes about two college student deaths every year. Suicide, sadly, causes about 1,000 college student deaths every year across the country. And numbers on alcohol, though there's some debate about them, causes probably about 1,800 college student deaths every year. Not necessarily from alcohol poisoning per se, but from accidents and injuries related to the use of alcohol. So for all to think about the things that are most likely to harm our students, we really need to have a conversation about this. Because in many ways, students come to college with the expectation that it's normal to drink a lot. The reality is that many of our students, upwards of 30 to 40%, actually are abstainers from alcohol. And so one of the most important discussions that you can have with your student about staying healthy is about making smart decisions related to alcohol. There's increasing new data that delaying substance use is beneficial, decreases the likelihood of harm, but also decreases the likelihood of the development of substance abuse later in life. We have some amazing resources here at the University of Maryland, and one of our School of Public Health professors has created this site called College Parents Matter. So I would encourage you all to take a look at it. It has some good tips about how to have conversations with your college student about alcohol, and though it's we're already partway into the year, so your student may scratch their heads when you bring this up over Christmas break, but still there's plenty of time to have a conversation about considering delaying the use of alcohol and other substances. And that is probably the single most important thing that you can do to keep your college student healthy. So in the realm of keeping your student healthy, this is a representation of the Empower initiative, which is between the University of Maryland and the University of Maryland, Baltimore. The key in keeping your student healthy is empowering them. I know that's a misspelling, but empowering them to take good care of themselves. I don't know if any of you have read this book, but in reality, keeping healthy on college campuses and in general is actually fairly straightforward. And many of these things are things that we all would say our grandmothers would have told us to do, but that we don't necessarily spend a lot of time paying attention to. So all you really needed to know you learned in kindergarten. So it's important to sleep. The fact that college students often don't get enough sleep contributes to them not learning as well, in addition to their immune systems being compromised, that they eat healthily, that they wash their hands. I included here, don't talk to strangers, substitute, i.e. make out with strangers as opposed to talk to, avoiding sharing utensils, drinking, sharing water bottles, drinks, and getting a flu shot. So all of these things are really pretty straightforward, but I think are of penultimate importance in keeping your college student healthy in addition. The other thing I just want to remind you all about, and I'm sure you're all on board with this, is the importance of immunizations. So we do have a number of requirements at the University of Maryland, but measles, mumps, rubella vaccine, tetanus, diphtheria, and pertussis vaccine. In particular, we're seeing outbreaks of pertussis on college campuses, which is whooping cough. We're also seeing scattered outbreaks of mumps on campus, believe it or not. So making sure that your college student comes with these immunizations in place. Meningitis, when we see it, is more often of this variety, the ACWY, as opposed to the meningitis type B. So making sure that your student has a meningitis vaccine. And then finally, there's lots of press out recently about the dangers down the road of human papillomavirus. For women, this can lead to cervical cancer, and men can lead to head and neck cancer. So having your student immunized against HPV is a really important consideration. So I just wanted to spend a moment on insurance. So the University of Maryland has what's called a hard waiver system, which means that every year students are required to enter insurance information that they have or be enrolled automatically into a school-sponsored plan. And the purpose of that waiver system is to be sure that every student who attends the University of Maryland has adequate insurance to cover them whilst they're here in the state. I just wanted to remind you all of a couple of things. If your student, particularly if you're out of state, has a restrictive network HMO, something like Kaiser, some Humana products, they're not necessarily bad insurance plans, but they may or may not allow your student to get care while they're in Maryland. So that's an important consideration. The second is that out-of-state Medicaid or Medicaid managed care organizations, which we're seeing an increasing number of given Medicaid expansion through the Affordable Care Act, will generally only cover emergency care when you're out of state. So that's an important thing to think about if your student has Medicaid or a Medicaid managed care organization. And these things are the reason why the University of Maryland has this hard waiver system. I would definitely check to be sure that your coverage applies to your student when they are in the state of Maryland if they're coming from out of state. The University Health Center participates in most insurance plans in Blue Cross and United, Aetna, and Cigna, though plans like Kaiser will not allow patients to be seen outside of the Kaiser network. The university does sponsor a student health insurance plan that covers students 100% for care here at the health center, as well as in the National United network. So it's a great option for folks who have out-of-state plans and want to make sure that their student is adequately covered when they're here in the state of Maryland. And it is a platinum level plan, so it's very comprehensive coverage. So I want to spend a few minutes just kind of talking about the things that are most likely to interfere with academic success in students. So this is data from the 2016 National College Health Assessment. And it shows that by far issues of stress, anxiety, sleep, depression, and working outside of school are much more likely to have academic impacts than illness per se. And the reason why I say this is because I think it's really important that we be aware that coming to a new environment, being in a new place, having different sets of expectations, and often without family around, can cause significant amounts of stress and anxiety. So going back to my previous statement about the conversation about alcohol, that is not the ideal way to manage issues of stress and anxiety, but we have much better ways to manage those things on campus, including our rec well, including free meditation here at the health center, and mental health resources on campus. So I put this in because I want to acknowledge that particularly for people who are living on their own for the first time, that illness is a really stressful thing. So often the stress is more significant than the illness itself. So I see some students who really have a hard time struggling through what for many would be considered to be a fairly straightforward upper respiratory infection, just because they're not used to sort of doing the whole thing on their own. So what I want to encourage you all to be are coaches through this process, so choose this, as opposed to freaking out. So try not to do that. In many circumstances, I see students who come in and they're actually doing okay, and they said, you know what, my mom told me I had to come in, which isn't necessarily a bad thing, but I wonder in the background sometimes if mom or dad or parent or grandparent are not freaking out more than the college student is themselves. Generally speaking, I would say that's not particularly helpful to the student who's trying to learn how to be independent and learn to take care of themselves. So our steps to approaching your illness in your college student: first are to breathe, 2 is don't catastrophize, and 3, just think about the fact that the stress of illness is often a significant factor. And again, we want to coach our students through the process of recovering to build resilience so that they turn into adults who can really make decisions and care for themselves. I realize as parents you're in this sort of awkward position of you know, seeing your child, particularly if it's your first child, leave the nest and the stress that's associated with that for you. But as a developing adult, it's really important for them to learn how to manage these situations independently. So a couple of things that I would encourage, if you haven't taught your student how to do this already, these are lessons that you need to talk about over Christmas break. The first is how to take your temperature is really important, because much of the decision making that we do here at the health center, at least as it relates to illness, is based on the presence or absence of a fever. So sending your student away with a digital thermometer, making sure that they know how to use that. The second thing I want you to coach them through is how to email their professors and communicate with their faculty members. Many faculty members are accustomed to managing classrooms where people will be sick. And I think they really appreciate it when students are proactive and reach out in advance and say, look, you know, I'm not feeling well, I don't want to get the rest of the class sick, so I'm going to not be in class today. How can I make up the work from today's class? So that proactive step is extremely important. There are occasions when professors push back and will ask for notes. There is a policy at the University of Maryland where a single absence from class can be documented by a self-signed attestation that the student has missed class. So they don't necessarily have to see a provider in order to get that documentation. And that's present on our website, on the Undergraduate Affairs website, and also here available at the Health Center. The third thing I want you to coach them about is getting adequate rest. I saw a young man the other day who came in, he was sick, and after our conversation he said, you know, can I play in my my ultimate frisbee game tonight? He was sick with some kind of febrile illness, and you know, I kind of said, well, you know, maybe that's not such a good idea. Perhaps you should go home and get some rest. Sometimes I think students are inclined to try to keep going despite the fact that their illness is present, and that's not always a wise choice. And finally, chicken soup. Again, a message from our grandmothers. Interestingly, some time ago, someone did a study on chicken soup and found that it had some effect on white blood cell, what's called chemotaxis, or the movement of white blood cells. So I'm a huge fan of chicken soup. Again, going back to what you learned in kindergarten and coaching your student to do those kinds of you know, common sense lessons. If your student needs to be seen at the health center, we're here, we're right in the center of campus. And I want you all to recognize that we are really experts in the care of this particular population, sometimes even to a greater degree than the pediatrician in the community might be, because we really have a sense of what's going on as it relates to illness within our particular college community. This is a view of our website, and if you click the About the University Health Center, and then there's a Clinical Services tab, this is sort of a rundown of all of the clinical services that we provide, and there are descriptions within each of these buttons to click. Your student can actually schedule an appointment online by using this tab here. One thing that I would say is coach them through the process of scheduling their own appointment as opposed to calling for them. Again, it's a really important and empowering thing for your student to be able to figure out how to do these things on their own. And this is a pretty user-friendly system. It can walk them through how to schedule an appointment with a provider. It's always great if students have had a meeting with one of our providers in advance, so they can say, go onto the MyUHC website and schedule an appointment with me because we've already met, and I think that increases the likelihood that we've established a relationship and trust. The second thing I wanted you to be aware of is after hours, when the health center is closed, because we're not open 24/7, we do have an after hours nurse line available. And so I actually just tested this out myself on the way to work this morning, and within about 30 seconds I was connected directly to a registered nurse who would have been able to answer my questions had I had them and wasn't just sort of testing the site. I think getting advice from a nurse after hours online often can avoid the need to go to an urgent care center or emergency room. As you know, emergency rooms are extremely expensive. So I would advise that your student take advantage of this. Again, on our site, we identify what to do in the event of an emergency. There are a variety of numbers here. We're coming out with a web redesign fairly soon, so these things will be all much more available and toward the front of our website when we redesign, but currently they're within About the University and Emergency and After Hours. And we much prefer that students go to urgent care centers as opposed to the emergency department, simply because the cost of an urgent care visit is probably about a third of what an emergency department visit would be. And we list a couple of local urgent care centers that are open extended hours, and these are the emergency departments that we typically suggest that students use. We don't provide transportation to these. Uber is a great option, and taxis are fairly available now in College Park as well, so I do encourage that students keep the Uber app on their phone. If not, we do have many students who actually have vehicles here on campus. We get reports back from emergency departments, at least, about students who visited after hours, and we really try hard to do a follow-up phone call within the next couple of days to make sure that the student has gotten their needs met adequately. Again, the health center is in the center of campus. Some students are under the impression that if they don't have the student health insurance plan that they can't use the health center, and that's actually not the case. We will courtesy bill most insurances, and we have a reduced rate for students who have plans that will not pay us directly, like Kaiser. So we offer a 50% discount on our fee schedule for students who have insurance plans that will not pay us. So I often hear from college first-year students that they're really amazed at how frequently they get sick. And so this is a colleague I actually just discovered has passed away recently, but from the University of Connecticut, who says every year freshmen come into my office and say, oh my God, I've never been this sick in my life. There must be something wrong with me. And he says, yes, you're a freshman. That's what's wrong. So living in congregate environments is sort of a setup for getting viral illnesses. And it's normal to get between 2 and 6 colds a year as a college student. That doesn't mean that your immune system is malfunctioning. It doesn't mean that there's anything wrong with you. It definitely doesn't mean that you need a series of antibiotics through the year. But I think it's important that you have this conversation with your student, that they may be sick more often the first year that they come to school than when they were in high school. Again, because they're exposed to a whole new set of viruses and in congregate settings that they weren't necessarily in high school. The other thing that some students are really amazed about, and I think families as well, is how long cold symptoms can last. So most students say, well, when I get a cold, I'm typically better within a couple of days. If you look at this graph from the Journal of the American Medical Association from a long time ago, back in 1967, about 30% of people are still coughing and with nasal discharge at 2 weeks post-illness. This is often an opportunity for education for our students when they come in with upper respiratory infection symptoms, is just going over the fact that this up to 2 weeks of symptoms is not abnormal, and coaching them through how they can alleviate symptoms whilst their body fixes the infection, I think, is a really important conversation. I did want to show you what the most common diagnoses are at the University Health Center for the calendar year 16 to 17. And as you can see, many of these, again, are mental health related problems, so anxiety and depression, upper respiratory infections, pharyngitis, cough, screening for sexually transmitted infections, and talk about birth control. Of these, the infectious conditions are listed here. It'll take a minute to come up. So of the conditions that I presented, these are the ones that are infectious. So acute upper respiratory infection or colds, pharyngitis, cough, urinary tract infection, vaginitis, and gastroenteritis. And the reason why I've highlighted the 2 in red is that these are the 2 that may be treatable with medications that we can prescribe, and the rest are generally treated by over-the-counter measures and self-care measures. And so your advice about how to manage colds, how to manage sore throats and coughs, gastroenteritis, all of these things are overwhelmingly caused by viruses. Your advice on how to manage these symptoms is really important. Again, just to emphasize that so much of the illness that we see on campus is caused by virus, and generally upper respiratory viruses. This is a study that one of our School of Public Health professors is doing called the CATCH study, or the virus study. He's actually looking at students who have fevers and what causes their illnesses. And again, overwhelmingly in this study, the viruses that are causing this are cold type viruses. And just to share again, most often our advice in terms of taking care of oneself in the face of a viral illness are the things that you would typically expect. About 3 years ago, we had a viral meningitis outbreak on campus, not bacterial meningitis, which is a very different condition. And I was advising the kinds of things that, again, I think my grandmother would tell me, which is avoiding those who are sick, washing your hands, disinfecting your living space. So I often recommend that students get Clorox wipes to wipe down their keyboard and doorknobs, not kissing or sharing glasses. And finally, if you're sick, stay at home. We often have this culture of people dragging themselves out of bed regardless of how poorly they're feeling, and that's really not a great idea. So I would advise your student, if they're sick, stay in bed. Again, reach out to your professors to let them know that you're not feeling well. So just a few minutes on antibiotics, because we have a lot of requests of folks who come in talking about antibiotics and who are under the impression that an antibiotic is the solution for their viral infection. And I'm sure, as you all know, that that's not the case. It's amazing how many antibiotics we prescribe in this country. So about 5 prescriptions per year for every 6 people in the United States. So almost 1 prescription for every individual who lives in the United States. And we know that there are a lot of downsides of antibiotics. At least 30% of antibiotics prescribed in this country are unnecessary, prescribed for illnesses in which they aren't indicated. And I think sometimes the reason for doing this is it's easier for a provider to write a prescription for an antibiotic than to explain why an antibiotic isn't necessary. And so we actually try to spend time talking with students about the meaning of a viral illness and why an antibiotic isn't indicated. Of course, we would use them if they were indicated, but very often they're not. And finally, if you total up all of the inappropriate antibiotic use, inclusive of unnecessary use and inappropriate selection and dosing and duration, about 50% of all antibiotics that are prescribed in the outpatient setting are inappropriate. So at the health center, and generally I would say within college health, we try to be very conservative about prescribing antibiotics. Of course, use them when they're necessary, but definitely not when they're not necessary. So I hope that gave you a little bit of information about how to empower your students, some basic things to keep your student healthy, a little bit of information about health insurance, sort of what's normal in college student illness, best ways to communicate with your student about illness, and then the dangers of antibiotic use that is unnecessary. I did want to give you a little heads up about, again, some things that we're seeing more of. Mumps. Many providers of my generation hadn't seen mumps because it sort of had died out for the longest time. We're seeing lots of outbreaks of mumps, most recently at Catholic University and American University. There have been outbreaks. We've had scattered cases, but never an outbreak. Measles mostly has resurged in the past couple of years because some people aren't vaccinating their kids. So I'm hopeful that none of you are in that category. This is a diplococcal organism that causes meningitis B. And so meningitis B vaccination is recommended in the midst of an outbreak, though its utility in vaccinating across the board college students is still unclear. And then finally, there's lots of talk recently about mosquito-borne illness. This is the Aedes aegypti mosquito that spreads things like Zika. I'm often talking with our travel groups about mosquito-borne illness and the importance of using mosquito repellent when you travel abroad, particularly to developing countries. So these are just things that are out there in the college health world to be aware of. Finally, I just wanted to share a picture of my 2 little Terps. These are my 2 nephews. Maybe someday they'll both be at the University of Maryland. This is Noah and Gavin. And per Kate, on January 9th, there'll be another webinar, Navigating Off-Campus Housing with Your Terp. And just wanted to take a few minutes to answer questions if you all had them.
Yes, please submit your questions. We'd love to share them with Dr. McBride. But actually, I have a question. We get a lot of calls at the Office of Parent and Family Affairs with parents who want to know what the conversation should look like when their student calls them at 6 o'clock in the morning, or you get a text message that says, I'm sick, I think I have a fever, I just feel horrible. What would be the next maybe leading question that a parent or family member could ask their student to really help them be proactive in addressing that health issue?
Yeah, well, I think, again, if your student has a thermometer, that's a really good objective data point. If you can have them measure their temperature, I think asking them what their temperature actually is. The next question, I think, is, so what have you done so far? Have you taken Tylenol? Have you drank fluids? Have you made sure that you're getting enough sleep? Could this be a result of you having stayed up too late last night? All of those questions in a very measured way. So trying to avoid reacting to your student's stress about the illness, I think, is a really important part. And then asking those questions that I mentioned. So the presence of fever. Did you do the things that we talked about before you left for college this fall? I think is a great way to sort of have the next step in that conversation.
Great. So we actually had a question come in, and I think it's a really good one. At what day of symptoms should a student go to the health center to be checked out?
Well, we're always happy to see students anytime in that process. Very often we have folks who come in and say, I woke up this morning and I'm not feeling well. They haven't necessarily even done any of the kind of self-care measures. And I would say probably giving most illnesses 24 to 48 hours is reasonable. With across-the-counter measures before you make a decision one way or the other. With something like a urinary tract infection, often, folks or young ladies in particular are really uncomfortable, so we're glad to have outreach from them straight away. But for the more common upper respiratory infections, I usually suggest that folks give it at least a couple of days of self-care measures, because that's usually what we're going to suggest as well, even if they come in. Part of the learning process about how to do all of this can be interacting with a healthcare professional. So again, we're always happy to see them, but it's often good to know that students have talked with mom and dad and said, okay, I've already done Tylenol, I've already done this, I've checked my temperature and I'm not feeling better. So after a day or two, checking in to see us. Another thing I did want to offer is for the patients who I regularly take care of, we have a secure online communication system, and we do a lot of communicating back and forth with students virtually through our portal. So when I have a patient who I know, often they'll send me a secure message saying, look, Dr. McBride, I haven't been feeling well. Do you have any advice about what I should do? And sometimes I can give them that advice virtually without having to have them schlep over to the health center. It saves them a copay, helps to give them a sense that they're taking good care of themselves. So that's just another way to approach getting advice in the midst of illness.
Great. I know a question that we often get in our office, and it's one that's just been submitted, but how would you advise a sick student who is stuck in their room with a fever that they're able to go get that chicken soup from dining services on campus?
Yeah, absolutely. So I haven't had the dining halls, haven't had dining services chicken soup, but I've had a lot of their other stuff, and it's actually really good. So I'm going to share the link that I just put up on my screen. So there is a program through dining services whereby students can get sick meals, and as you can see, soup of the day is on the list. So a student can go onto this site, fill out their information, and a fellow student can go to the dining hall and pick up the food and bring it to them. I recall back to when we were dealing with H1N1 flu a couple of years ago, and we were encouraging students to get what we called at the time a flu buddy, which is a friend who could go to give you a hand and pick something up at the dining hall in the event that you were to get sick. And so a roommate may serve this purpose, a friend can serve this purpose, but this is a great way to get food when you're not feeling as if you can necessarily get out of your room yourself. I think often, as far as sickness goes, if students get a little Tylenol in their system and feel a little less achy, often they're able to drag themselves out of their rooms. So that would be another bit of advice, is using those across-the-counter medications to lessen symptoms.
Great, and I think we actually have time for one more question, and there have been a few related to those managing anxiety and stress pieces that you mentioned were so important in a student's health. So what are some of the services that the University Health Center offers or are just available on campus, like, for example, massage or acupuncture? How could students access those resources, and what, if any, cost is associated with those?
Yeah, absolutely. So I'm going to pull up our website here, if I may, just so I can show you directly. So at the health center, we have massage, acupuncture, and meditation that are most often associated with non-therapy kinds of stress reduction. And so meditation is actually free to students. So that's a service that they can call the health center and schedule an appointment with Edie, who's our meditation specialist. She also does group meditations, and this past year she's done a mindfulness meditation class. So this tab on the website would direct students to those services. As far as acupuncture and massage goes, There are charges associated with those, but they're significantly discounted from what you would find if you went to the community. I think a massage hour is $60, and an acupuncture hour is about the same. So the cost as compared to if you went into the community to have massage services is very much more affordable. A lot of managing stress and anxiety really is about being engaged in non-academic activities on campus. So encouraging your student to be involved, encouraging them to use the rec well, encouraging them to go to floor meetings, and all of these sorts of things that are part of the typical college experience, I think, are, again, ways that you can coach your student and really in many ways safeguard them against stress and anxiety, because if they're engaged, they're much less likely to suffer with those kinds of stresses. And then if it turns out that your student is in need of a more counseling kind of service, we do offer mental health services here at the health center. I'll pull that up. So we are primarily psychiatrically focused here at the health center, so most of the patients who are seen here are taking medication for mental health disorders, but there's also a counseling center on campus, and they have both individual as well as group opportunities for care related to anxiety and stress and other mental health disorders.
Great. Thank you so much for taking the time to join us today, Dr. McBride. And as you saw on a previous slide, we hope that you will join us for our next webinar on Tuesday, January 9th, 2018, in the new year, where we're going to learn more about helping your Terp navigate the off-campus housing process. So with that, the recording will be made available on the Terp Family YouTube page later this week, and you will receive a follow-up email with a link to this presentation, as well as a lot of the great resources that Dr. McBride outlined. You can also follow us on social media to get access to the information, and we hope that you will. And with that, we hope you have a great day.